I need you to do something right now before you hear another word. Place 2 fingers against the side of your neck, just below your jaw. Feel that steady rhythm pressing against your fingertips. Without asking you for anything. Now here's a question that most people over 60 cannot answer correctly. When does your heart face its greatest danger? Most people say a few say during an argument. Every single one of those answers is wrong. The most dangerous moment for your heart is not during the day at all. It happens while you are asleep. It happens in the dark. Here's what makes this so urgent. The thing that determines whether your heart survives those hours is not some random event. It is a set of habits that you perform every single night before turning off the light. Habits you have probably never thought twice about. I am Dr. holding human hearts in my hands. I have also spent over 20 years watching the same preventable patterns destroy patients who had absolutely no idea. 5 of those patterns. 5 habits that are quietly loading a weapon while you sleep. Then before I reveal the first habit, you need to understand something about your body that almost nobody over 60 has ever been told. Your cardiovascular system does not take a break. A different gear. In a healthy body, nighttime is when your blood pressure naturally drops, usually your arteries relax. It is a biological reset, a form of maintenance your body has been performing since the day you were born. But after the age of 60, that system becomes unreliable. The machinery that once operated flawlessly begins to falter. Your blood vessels become stiffer, like old rubber tubes that have lost their elasticity. Your blood pressure regulation becomes imprecise, swinging higher and lower than it should. Certain hormonal signals that once protected your heart during the night begin to weaken and fade. The margin for error shrinks dramatically. Think of it this way. During the day, your cardiovascular system has backup mechanisms. It can compensate, it can adapt, it can reroute blood, adjust heart rate, and release protective hormones on demand. At night, many of those protective mechanisms go offline. Your body operates with a skeleton crew. That is what makes the night so fundamentally different after 60. That is why the hours between midnight and 6 in the morning carry the highest risk of heart attack and stroke for older adults. Not the afternoon, not the morning rush hour, the quiet hours. The hours when no one is watching. But your habits are. Now here's the part that changes everything. What happens during those dangerous hours is largely determined by what you did before going to bed. The meal you ate, the medication you took or forgot to take, the glass of water you chose not to drink, the temperature you set on your thermostat. These are decisions that feel completely routine, invisible, harmless, but they are not harmless. They are the difference between waking up tomorrow morning and not waking up at all. I learned this not from a textbook, but from a recovery room. I was standing beside a patient named Margaret, a 67-year-old woman who had survived a massive heart attack at 3 in the morning. Her husband had found her unconscious in bed. He had performed CPR until the paramedics arrived. She was alive, but barely. As I stood there looking at her monitors, I asked her husband a simple question. What did she do last night? He described their evening in ordinary detail. They had eaten a large dinner around 9. She had taken her blood pressure medication that morning, but forgotten the second dose. The bedroom had been warm because the heater was running. She had not drunk anything after 6 in the evening because she did not want to wake up to use the bathroom. And she snored. She had snored for years. Everyone thought it was harmless. As I listened to this ordinary description of an ordinary evening, I realized something that would change how I practiced medicine for the rest of my career. Her heart attack was not an accident. It was a consequence. A predictable, preventable consequence of 5 habits that nobody had ever told her were dangerous. She survived. Many of my patients did not. And that is why I am telling you this now. because the first habit I am about to reveal is the one that surprises my patients more than any other. It is something almost everyone over 60 does, something you probably did last night without thinking. Something so ordinary that you will struggle to believe it could affect your heart at all. But the science is clear, and what I am about to tell you about your dinner plate may completely change the way you eat for the rest of your life. Let me ask you something directly. What time did you eat dinner last night? And what was on your plate? I ask every single patient those two questions. The answers are remarkably consistent. Most people over 60 tell me they ate dinner somewhere between 8 and 9 in the evening, sometimes later, sometimes as late as 10. A full meal. Pasta with creamy sauce, rice and meat, something fried, maybe dessert, followed by sitting on the couch for an hour or two and then going straight to bed. I understand why it happens. Busy days, family schedules, habits built over a lifetime. It feels normal. It feels harmless. But from a cardiac perspective, this routine is quietly harming your heart in ways you have never been told. A heavy meal late at night is one of the most underestimated stresses your heart can experience. Here is what is happening inside your body when you eat a large meal close to bedtime. Your digestive system suddenly demands a tremendous increase in blood flow. To meet that demand, your heart has to pump harder. Your blood pressure rises. Triglycerides, which are the fats circulating in your bloodstream, rise sharply within 2 to 4 hours after eating. Now combine that with going to sleep. Your body expects the evening to be a period of winding down, a slow descent into rest and repair. Instead, your heart is working overtime to digest a heavy dinner while simultaneously trying to transition into its nighttime recovery mode. Those two demands directly compete with one another. Digestion is pulling blood toward your stomach. Your heart is trying to reduce its workload. Your blood pressure is climbing when it should be falling. Your triglycerides are spiking when your arteries are most vulnerable. And for someone over 60 with even a moderate degree of arterial stiffness, that conflict can have devastating consequences. The research supports this with striking consistency. Studies have shown that eating within 2 to 3 hours before bedtime is associated with elevated nighttime blood pressure. It is associated with a higher incidence of acid reflux, which can mimic or even directly trigger cardiac symptoms. And it is associated with an increased risk of cardiovascular events during sleep. Let me explain that last point because it is critical. Acid reflux caused by a late heavy meal can produce chest pain that is nearly indistinguishable from the pain of a heart attack. I have seen patients rush to the emergency room convinced they were dying, only to discover that their symptoms were caused by reflux from a late dinner. But here is the terrifying part. In some cases, the reflux is not mimicking a cardiac event. It is actually triggering one. The physical stress of reflux can cause a vagal response that destabilizes heart rhythm. The inflammation from chronic reflux can irritate the esophagus in ways that refer pain to the chest and create genuine cardiac stress. The line between harmless indigestion and a cardiac emergency becomes dangerously blurred after the age of 60. I remember a patient named Robert. He was 64 years old, a retired teacher. He came to me after a terrifying episode that happened at 2 in the morning. He had eaten a large dinner at 9. A steak, mashed potatoes, gravy, and a slice of pie. He went to bed at 11. At 2 in the morning, he woke up with crushing chest pain, sweating, gasping for air. His wife called emergency services. By the time he reached the hospital, his blood pressure was dangerously elevated and his heart was showing signs of ischemia, which means it was not getting enough oxygen. Robert survived. But when I reviewed his case, the pattern was unmistakable. His heart had been forced into an impossible situation, digesting a massive meal while trying to maintain its nighttime rhythm. His arteries, already narrowed by years of plaque buildup, simply could not handle the dual demand. The solution is not complicated. It does not require a radical diet or a complete overhaul of your lifestyle. Finish your main meal by 6 or 7 in the evening whenever possible. That gives your heart 3 to 4 hours to complete the work of digestion before you go to sleep. If you absolutely must eat later, keep the meal light. Focus on lean protein and vegetables instead of heavy, fatty, carbohydrate-dense foods. A piece of grilled fish with a side of steamed vegetables will not stress your heart the way a plate of pasta with cream sauce will. Does your dinner schedule resemble what I just described? You might be surprised by how many people answer yes without ever realizing it could affect their heart. But the dinner habit is only the beginning. The next habit I am going to reveal is the one that causes some of the most preventable damage I see in my practice. It involves something that more than 60% of people over 60 do every single day. Something they take for granted. Something they assume is working just fine. But for many of them, it is not working. It stopped working hours ago. And they have no idea that while they sleep tonight, their heart will be completely unprotected against a danger that has a specific name. A name most people have never heard. But by the time I finish explaining it, you will understand exactly why this one habit could be the most important conversation you ever have with your doctor. I need you to pay very close attention to this next section, because this is where some of the most preventable cardiac damage occurs. In my clinical experience, if you are over 60 and you take medication for high blood pressure, and statistically more than 60% of people in this age group do, the timing of that medication matters enormously. It matters far more than most physicians take the time to explain. For most people, blood pressure follows a predictable daily rhythm. It rises in the morning as your body wakes up. It peaks during the afternoon when you are most active, and it falls at night as you prepare for sleep. This natural nighttime drop is called dipping. It is one of the most important protective mechanisms your cardiovascular system has. When your blood pressure dips at night, your arteries get a break. Your heart gets a break. Your entire circulatory system enters a state of reduced stress that allows for repair and recovery. But here is the problem that almost nobody knows about. A significant number of people over 60, especially those with hypertension, never experience that normal nighttime drop. Their blood pressure does not fall at night. It remains elevated. Or worse, it actually surges during the early morning hours while they are still asleep. This condition has a name. It is called nocturnal hypertension, and most people have never heard of it. Yet it is dangerous in ways that ordinary daytime high blood pressure is not. Let me explain why. While you sleep, your arterial walls are not prepared to withstand sudden pressure surges. During the day, your blood vessels are toned and ready. They can handle fluctuations. They can expand and contract as needed. At night, your blood vessels are in a relaxed state. They are expecting lower pressure, not higher. A spike in blood pressure at 3 in the morning affects your arteries very differently than a spike at 3 in the afternoon. It is more likely to rupture a vulnerable plaque inside a coronary artery. It is more likely to trigger the formation of a blood clot. It is more likely to send someone to my operating table at dawn. Now think about how most people take their blood pressure medication. They take it in the morning. It works throughout the day. But by the time night arrives, the medication's effectiveness has been declining for hours. By 3 in the morning, when your heart is most vulnerable, the medication may barely be working at all. If you take your blood pressure medication only in the morning, it may no longer be protecting you when your body needs protection the most. And if you forget to take it altogether, you may be leaving yourself completely unprotected during the most dangerous hours of the entire 24-hour cycle. There is strong scientific evidence supporting this. The Hygeia chronotherapy trial, a landmark study involving thousands of patients, found that taking blood pressure medication in the evening rather than the morning significantly reduced cardiovascular risk during sleep. The results were not marginal. They were substantial. Patients who took their medication at night had lower rates of heart attack, stroke, and cardiovascular death compared to those who took it in the morning. That is not a minor adjustment. That is a potentially life-saving change. So what should you do? Talk to your doctor specifically about medication timing. Ask whether your blood pressure medication should be taken in the evening instead of the morning. That conversation takes approximately 2 minutes. 2 minutes that could change the trajectory of your cardiovascular health for the next decade. Never assume that timing does not matter. In cardiology, timing can make all the difference between a stable artery and a ruptured one. I had a patient named Eleanor. She was 71 years old. She had been taking her blood pressure medication in the morning for over a decade. Her daytime readings were acceptable. Her doctor was satisfied. But when we conducted a 24-hour ambulatory blood pressure monitor test, the results were alarming. Her nighttime blood pressure was consistently elevated, sometimes spiking to dangerously high levels between 2 and 5 in the morning. She had been going to sleep every night with essentially no medication protection during her most vulnerable hours. We moved her medication to the evening. Within weeks, her nighttime blood pressure normalized. Her risk profile improved dramatically. She had been living with a hidden danger for years, and a 2-minute conversation resolved it. Yet most people over 60 have never had this discussion with their doctor. They take their pill in the morning, assume everything is fine, and never realize that their heart is spending every night unprotected. But medication timing is only the third piece of this puzzle. The next habit I am going to reveal involves something that happens while you are already asleep. Something that most people dismiss as a joke. Something that earns an elbow from a sleeping partner and a laugh the next morning. But I treat it as a warning sign of heart disease until proven otherwise. After 20 years in this field, I mean that literally. And what I am about to tell you about the sound coming from beside you in bed may be the most alarming thing you hear in this entire conversation. That sound is snoring. Most people think it is nothing more than an annoyance that disturbs their partner's sleep. They joke about it, they ignore it, they learn to live with it. But loud, persistent snoring can sometimes be a warning sign that your body is struggling to breathe properly during the night. And when breathing repeatedly stops during sleep, your heart may pay a far greater price than you ever imagined. I want you to think about someone you know who snores. Maybe it is your spouse lying next to you right now. Maybe it is one of your parents. Or maybe it is you. That loud, irregular rumbling sound during the night. Most people dismiss it as an annoyance, something to joke about over breakfast. Something that earns an elbow from a partner in bed and a half-hearted apology in the morning. I treat it as a warning sign of heart disease until proven otherwise. After more than 20 years in this field, I mean that absolutely literally. Sleep apnea is one of the most underdiagnosed and underestimated conditions I see in patients over 60. It is estimated that more than 30% of older adults have some form of sleep apnea. Yet the vast majority have never been diagnosed. They have never been treated. They have absolutely no idea what it is doing to their heart every single night. Here is what actually happens during an episode of sleep apnea. You stop breathing. Not for a moment, not for a brief pause. You stop breathing for 10 seconds, 20 seconds, 40 seconds, sometimes even longer. And it may happen dozens of times every single hour. Each time it happens, the oxygen level in your blood drops dramatically. Your brain detects a crisis. It does not know you are asleep. It only knows that oxygen has stopped arriving. So it immediately activates a full stress response. Adrenaline floods your bloodstream. Cortisol rises. Your heart rate suddenly accelerates. Your blood pressure spikes sharply. Your heart is essentially jolted awake while the rest of your body remains asleep. Now imagine that happening not once, not twice, but 30, 40, or even 50 times in a single night. Night after night, month after month, year after year. What that does to your cardiovascular system is anything but subtle. Sleep apnea is directly associated with a 3-fold increase in the risk of heart attack. Let that sink in for a moment. 3 times the risk. Not a marginal increase, not a slight elevation, triple. It is also strongly linked to irregular heart rhythms, including atrial fibrillation, a condition that dramatically increases the risk of stroke. It accelerates the thickening and stiffening of arterial walls. It raises blood pressure. It damages the lining of blood vessels. And because all of this happens while you are asleep, most people have absolutely no idea anything is wrong until a serious cardiac event occurs. The warning signs are not always obvious. Yes, loud snoring is one of them, but there are several others that you need to know about right now. Watch for waking up with morning headaches. Watch for feeling exhausted despite getting what should have been a full night of sleep. Watch for needing to urinate frequently during the night. Watch for waking up with a painfully dry mouth. Watch for waking with a sensation of choking or gasping for air, as if something was strangling you from inside your own throat. If any of those symptoms sound familiar, you need to talk to your doctor about having a sleep study. Not next month, not at your next annual checkup, soon. I had a patient named Arthur. He was 68. His wife had been telling him for years that he stopped breathing during the night. He laughed it off. He said he was just a deep sleeper. He said the snoring was normal for a man his age. Then one morning, he woke up with chest pain. Not the dramatic, crushing kind you see in movies. A dull, heavy pressure that would not go away. He came to my office. We ran tests. He had significant blockage in two coronary arteries. When we conducted a sleep study, we discovered he was experiencing over 60 apnea episodes per hour. 60 times every hour, his breathing stopped, his oxygen dropped, and his heart was slammed with adrenaline. His heart had been under nightly assault for years, and he had no idea. Here's what I tell my patients directly. If you snore heavily, you are over the age of 60, and you have any history of heart disease or stroke, being evaluated for sleep apnea is not optional. It is not a suggestion. It is not something to consider when you have time. It is an essential part of your cardiac care. The treatment, most commonly a CPAP device, is not glamorous. I know that. It involves wearing a mask over your face while you sleep. It takes getting used to. But the scientific evidence regarding its benefits for heart health is remarkable. Patients who consistently use CPAP therapy experience measurable reductions in blood pressure. They have lower rates of atrial fibrillation. They have significantly reduced cardiovascular risk overall. One device, one habit, enormous protection. Does anyone in your household snore? Has anyone ever told you that you stop breathing while you are asleep? Think carefully before you move on from this section, because the next habit I am going to reveal is driven by perfectly logical reasoning. It makes complete sense. That is exactly why it is so easy to overlook. And it involves something you have probably been avoiding every evening for years, thinking you were doing the right thing. But what I am about to tell you about the glass of water you chose not to drink may change the way you think about your bedtime routine forever. The explanation is surprisingly simple, but understanding it could completely change your nightly routine forever. Let us talk about a habit that is driven by perfectly logical thinking, and that is exactly why it is so easy to overlook and so dangerous. Many people over the age of 60 intentionally reduce how much they drink in the evening. The reason makes complete sense. They want to avoid waking up at 2 in the morning to use the bathroom. Interrupted sleep is frustrating. It leaves you tired the next day, and getting out of bed in the dark increases the risk of falling, which is a serious concern for older adults. So they stop drinking fluids after dinner. Sometimes they stop drinking after 4 in the afternoon. They go to bed dry and wake up dry, proud of the fact that they slept through the night without interruption. I completely understand the reasoning. It is sensible. It is practical. It feels like the smart thing to do. But from a cardiovascular perspective, going to bed even slightly dehydrated is a significant risk factor, and it is one that almost nobody talks about. Not your neighbor, not your pharmacist, not, in many cases, even your doctor. Here is what happens inside your body when you are dehydrated. Your blood becomes more viscous. It becomes thicker. It does not flow through your blood vessels as easily. Think of the difference between water and syrup. Water pours quickly and smoothly. Syrup moves slowly, resisting every step of the way. When your blood thickens from dehydration, it behaves more like the syrup. For a younger cardiovascular system with flexible, healthy arteries, that increased viscosity is usually a manageable inconvenience. The body can compensate. The heart can adjust. The blood vessels can adapt. But for someone over 60 who already has stiffened arteries and plaque buildup, it is an entirely different situation. Thicker blood moves more slowly through arteries that are already narrowed. It forces the heart to pump harder to push the same volume of blood through tighter spaces. And critically, thicker blood is more likely to form dangerous clots. Now here's the timing issue that most people never consider. During sleep, your heart rate naturally slows down. Your blood circulation also slows. Your body is motionless. Blood is moving through your vessels at a reduced pace. Now combine that slower circulation with thicker blood in a body that remains motionless for 7 or 8 hours, flowing through arteries that may already be partially blocked by plaque. That combination, dehydration, slower heart rate, reduced movement, and underlying arterial disease, is one of the primary reasons why heart attacks and strokes occur so frequently during the early morning hours. Your blood is literally struggling to flow through spaces that are already compromised, and nobody is awake to notice that something is going wrong. I had a patient named Patricia. She was 65 years old. She had been avoiding fluids after 5 in the evening for years because she hated waking up to use the bathroom. She was proud of this habit. She considered it a sign of discipline. One morning, her husband found her unable to speak clearly. The right side of her face was drooping. She was having a stroke. At the hospital, tests revealed that a blood clot had formed in one of her cerebral arteries during the night. Her doctor told her that her severe overnight dehydration had likely contributed to the clot formation. She had been systematically dehydrating herself every evening, thinking she was protecting her sleep, while quietly increasing her risk of a stroke. Fortunately, the solution to this problem is remarkably simple. Drink 1 full glass of water before going to bed. Not a large amount, not a gallon, just about 8 ounces. That is all you need. It is enough to help prevent your blood from becoming unnecessarily thick while you sleep. Keep another glass of water on your bedside table for when you wake up. If you wake up feeling slightly thirsty at 2 in the morning, your body is asking for something that your heart also needs. Do not ignore that signal. You do not have to choose between getting a good night of sleep and protecting your cardiovascular health. A single glass of water before bed and a glass on your nightstand can make a meaningful difference. Will you still wake up to use the bathroom occasionally? Possibly, but consider the trade-off. A brief interruption to your sleep versus a blood clot that could end your life. That is not a difficult choice. Now, we have covered 4 habits: late dinners, medication timing, sleep apnea, dehydration. Each one is significant on its own, but the 5th and final habit is perhaps the most surprising of all because it sounds almost too simple to make any difference. It involves something you adjust without thinking every single night. Something you have probably never once connected to your heart health, but the temperature of your bedroom is silently shaping what happens inside your arteries while you sleep. And what I am about to tell you about the number on your thermostat may be the easiest fix in this entire list, while also being one of the most important. What temperature is your bedroom at night? Most people answer that question based on comfort alone. They never consider what it might mean for the quality of their sleep or the workload placed on their heart. Yet throughout the night, your body is constantly working to maintain a stable internal temperature. If your bedroom is excessively warm, your body has to release more heat. You may sweat more, wake up more often, and experience less refreshing sleep. On the other hand, if the room is uncomfortably cold, your body must work harder to stay warm, which can make restful sleep more difficult. Neither extreme is ideal. Research suggests that a cool, comfortable sleeping environment generally supports better sleep quality for most adults. Better sleep allows your body to recover more effectively and helps your cardiovascular system perform its normal overnight functions. That is why sleep specialists often recommend keeping the bedroom comfortably cool, using breathable bedding, and maintaining a consistent sleep environment. These may seem like small details, but small habits repeated every night can have a meaningful impact over time. Sometimes the greatest improvements in health begin not with expensive treatments or complicated routines, but with simple changes that help your body do what it was designed to do while you sleep. Here is a habit that surprises almost every patient when I mention it, because it sounds almost too simple to matter. What temperature is your bedroom at night? Most people have never considered that question from the perspective of heart health. They think about comfort. They think about personal preference. They think about whether they like sleeping warm or cool. But your cardiovascular system actually performs best within a specific temperature range. Outside that range, your heart quietly works much harder than it should, and you would never know it. Let us start with a bedroom that is too warm. When the temperature rises above approximately 22 degrees Celsius, or about 72 degrees Fahrenheit, your body has to work continuously throughout the night to release excess heat. Your blood vessels dilate, your heart rate remains elevated instead of slowing down. You sweat more, which increases fluid loss and brings us right back to the dehydration problem we just discussed. Perhaps even more importantly, your sleep quality declines significantly. You spend less time in the deep, restorative stages of sleep, the stages during which your heart performs its most important overnight recovery and repair. You might be in bed for 8 hours, but if the room is too warm, your heart is getting only a fraction of the restoration it needs. Now let us look at the opposite extreme. A bedroom that is genuinely too cold, below approximately 16 to 17 degrees Celsius, creates a completely different kind of cardiovascular stress. Cold temperatures cause vasoconstriction. Your blood vessels constrict to preserve your body core temperature. As they tighten, your blood pressure rises. Your heart has to pump against greater resistance. For someone already living with coronary artery disease or high blood pressure, that increase in nighttime blood pressure is far from insignificant. It is a silent, sustained stress that compounds over hours. The optimal bedroom temperature for both quality sleep and cardiovascular protection is between 18 and 22 degrees Celsius, or 65 to 72 degrees Fahrenheit. Within that range, your body remains in what scientists call a thermally neutral state. Your blood vessels stay relaxed. Your heart rate remains low and steady. Your sleep stays deep and restorative. One simple thermostat setting, real protection, zero cost. Now let me bring everything together because I know this may feel like a long list of things to worry about. But I want you to look at it differently. When you put all 5 habits together, what you actually have is a practical blueprint for protecting your heart every single evening. I call it the heart-safe evening routine. Here is what it looks like. Between 6 and 7 in the evening, eat your main meal. Choose lean protein, vegetables, and a moderate serving of carbohydrates if you need them. Not an enormous feast, not skipping dinner entirely, just a balanced meal at a reasonable hour. That gives your heart 3 to 4 hours to finish the work of digestion before you go to sleep. Around 7 in the evening, focus on water and your medications. If Dr. Jane has not specifically discussed the timing of your blood pressure medication with you, let this be your reminder to have that conversation. For many people, taking blood pressure medication in the evening may provide significantly greater protection during the most dangerous hours of the night. Between 8 and 9, enter your wind-down period. Take a gentle walk, read a book, have a calm conversation. Step away from screens, especially the bright screens of smartphones, which suppress melatonin production and keep your nervous system alert long after they should. By 9, prepare your bedroom. Adjust the thermostat to that optimal range. Open a window for a few minutes if necessary. Place a glass of water on your bedside table. These tasks take less than 90 seconds, but they matter more than you can measure. By 10, you should be in bed. And here is one final detail that costs absolutely nothing. If you snore, or if someone has ever told you that you stop breathing while you sleep, try sleeping on your side instead of your back. Sleeping on your back can dramatically worsen airway obstruction. Simply changing your sleeping position can significantly reduce episodes of sleep apnea while you arrange for a formal medical evaluation. Dinner by 7, water and medications around 7, a calm evening until 9, your bedroom prepared by 9, in bed by 10. Sleeping on your side. The question is never whether this routine works. The scientific evidence is clear that it does. The real question is whether you will follow it. That is a question only you can answer. Let me speak to you honestly for a moment, not as a content creator, but as a surgeon. I have stood beside an operating table at 3 in the morning, holding a heart that had stopped because a blood clot formed overnight inside a narrowed coronary artery. I have spoken with families sitting in hospital waiting rooms at dawn, families who had no idea anything was wrong when they wished their loved one goodnight just hours earlier. In case after case, the contributing factors were not mysterious. They were a late dinner, a missed blood pressure pill,